Okay, we'll go ahead and get started. Thank you all for joining us today. My name is Kristen Schuster. I'm with Mountain Pacific Quality Health, and I'm excited to present Times Pharmacy, and they're going to talk through their diabetes education services. I have Cleanne Toner, who is the clinical pharmacy manager, as well as Shelby Meter, who is the diabetes education coordinator. The session today is going to cover services as well as eligibility requirements for patients in order to engage their different services. So with that, I will turn it over to Cleanne to talk about her background and get us kicked off on the presentation. Take it away, Cleanne.
Oh, thank you very much, Kristen, for that wonderful introduction. Aloha and welcome to our Times Pharmacy webinar. Like Kristen said, I'm the clinical pharmacy manager here at Times, and I'm joined with Shelby, our diabetes education coordinator. We are both very excited today to share the diabetes services we're able to provide for your patients, as well as our local community. Please feel free to pop some questions in the chat as you think of them, and towards the end, we'll have time for questions and answers. So next slide, Kristen. All right, so I'm going to first start off with the services we have for our patients that are diagnosed with diabetes and are 18 years of age or older. We do offer a couple of options for these patients, the first being our Teach Me Diabetes program. We're able to provide this class in person or online, and we like to start it off with a one-on-one appointment with each patient. This initial interaction really just involves us getting to know the patient, assessing their health status, what medications they're taking, what diabetes knowledge they have coming to us, and their current lifestyle practices. We do go through the ADCES, or the Association of Diabetes Care and Education Specialists 7 self-care behaviors. And we make a plan with the patient in regards to when they're able to start classes with us, and just really focus on their goals and what they'd like to work on moving forward. So once we have that initial interaction done, and we have at least 5 patients, we're able to set a date and time for group classes. And what that involves, the patients will attend a series of 1 to 2 hour classes for 9 hours in total. And we focus on those 7 self-care behaviors I mentioned previously. So those are your healthy eating, being active, monitoring, taking medications, problem solving, reducing risks, and healthy coping. So these classes are really interactive. We try to bring different ideas and teaching methods to the classes to keep our patients interested and coming back. But our big goal, or our main goal with these classes, are for the patients to walk away feeling more confident with the knowledge and skills necessary to really make the best possible decisions in regards to their own diabetes care. So once the patient does complete our program, their post-assessment, education, interventions, and any outcomes documentation will be forwarded back to the referring provider, along with any recommendations for further follow-up. Next slide. So as far as our class locations go, we do have a partnership with Mario Savio Medical Complex, and we are going to be starting a Saturday DSMES group class in July. We are also able to hold classes at the HMSA Center in Pearl City, and hope to have a Wednesday weekday group starting there soon as well. For those patients closer to our main pharmacy office, we are able to use our conference room at the Times Pharmacy Kamehameha location. And as our services expand, we are always looking for convenient locations out in the community for our patients. So if you do decide that you'd like to refer any of your patients to us for our diabetes self-management education services, we need you to fill out our Times Pharmacy DSME consent and intake form, which will be emailed out to you following our presentation from Kristen, along with a PDF of our slides and a link to our recording for future reference. It would be really helpful for us to also have a copy of the patient's last doctor's visit, their medication list, and their most recent labs, mainly to include their A1C and a lipid profile. And then following the completion of our program, once we get done with all those group classes with the patients, we'll also send out a request for current labs to incorporate into any follow-up sessions with the patients, as well as for data collection in regards to quality improvement and measuring the success of our patients in these programs. Next slide, please. So if your patients don't feel comfortable meeting in a group setting, we are also able to provide continued one-on-one sessions. We are able to cover the same information as our group classes, and we can meet with the patient in a convenient public location, a virtual setting online, or over the phone. We offer convenient scheduling to try and find the best time available for the patient. And as with our group classes, we really work with the patient to develop their goals and what they feel they need to work on in order to be confident coming away from our, discussions and our meetings. Next slide, please. So we also have a diabetes prevention program that we're starting up. We do this with CDC recognition for both our in-person and online programs. Currently, I don't know if you guys know or not, but about 37.1% of Hawaii's adult population are living with prediabetes. And we are hoping through some of our programs that we can help reduce that number that actually progress to diabetes. Both programs are a lifestyle change program and are a one-year commitment, which, as we all know, this can be really tough for our patients to commit to something for a full year. But the idea behind that duration is that it can take a while to make these lifestyle changes that will stick with the patient going forward. So the first half of the year, our classes really focus on making those changes, while the second half focuses on maintaining the changes that they've made. So really patients to think about when you see them in your service or in your practice that are at higher risk for prediabetes would be those that are 45 years and older, they're overweight, they might have a parent, brother, or sister with type 2 diabetes, physically active fewer than 3 times a week, if they ever had gestational diabetes while pregnant, or gave birth to a baby who weighed more than 9 pounds. So that moves into, next slide, please. The eligibility for our diabetes prevention program, the patients must be 18 years of age or older, have a BMI of 25 or more, or if they're Asian, 23 or more, not previously diagnosed with diabetes or currently pregnant, plus one of the lab values listed below, one of the following. So the lab values listed, a history of gestational diabetes, or a high risk score on a pre-diabetes risk test for our non-Medicare patients. If the patient does have Medicare, this risk test would not count as one of the eligibility factors. We also have a diabetes prevention program intake and referral form, like our DSMES classes. And we'll also get that sent out to you guys as well. Next slide, please. So just to talk a little bit about our in-person program, our in-person DPP follows the Prevent T2 curriculum that's led by the CDC. This was just recently updated this past year. It's a great program. It's actually been shown to cut the risk of developing type 2 diabetes in high-risk patients by around 58%. So that's a pretty large number there. And much like our DSMES classes, participants do meet in groups to learn about healthy eating, physical activity, problem solving, stress reduction, and coping skills. The plan is to meet for an hour once weekly, and usually this will be on the same day of the week for consistency for 16 weeks, and then we will move to meeting once or twice a month for the second part of the year. And our minimum to start a diabetes prevention program class is also 5 patients, and we can coordinate with one of our community partners for a convenient location as well for your patients. Next slide, please. Moving on to our online DPP program, this is through the HALT, or Health and Lifestyle Training platform, that is on our Hawaii Diabetes Prevention Program website. So each participant in our online program will be assigned a personal health coach from our office, as well as given online peer support from their class. That's all starting at the same time. The patient will be able to access the online program through their smartphone, tablet, or computer, and it's completely on their own time. Hawaii DPP offers the participants interactive and engaging online video lessons. There's easy tracking on, they can do it right on their smartphone for exercise and nutrition. And also unlimited private feedback and consultation with us, their personal health coaches, throughout the 12 months. The time requirement for the online program follows the in-person program, with your patient committing 60 minutes every week for 16 weeks, and then it drops to once to twice a month for the remaining 6 months. The online program is also a little bit more flexible, though. The patients can really do it at their own pace. However, they're not able to skip ahead and finish early. The lifestyle change programs are really focused on, the duration of the year and reinforcing, all the goals that our patients are trying to reach. Next page, please. So insurance, in regards to health insurance coverage, we have listed here who we are contracted with to provide these programs to. But I do want to note, if your patient's insurance is not listed and you do feel like they would benefit from one of our programs, please reach out to us. We might be able to provide these services to those individuals outside of the insurance coverage. We really like to get these programs out to the community and reach as many patients as we can. Next slide, please. So these are just some additional pharmacy services we are able to provide here at Times Pharmacy. We have 12 locations here on Oahu and 1 in Maui. And along with our prescription and diabetes services, we also offer on-site business vaccination clinics and can provide just about any vaccine to your staff. We're also currently booking for the yearly fall flu clinics, so feel free to contact us for those as well. But we're just really looking forward to working with all of our community partners and trying to get our diabetes programs out into the community. So next slide. I believe we're to the questions. Does anybody have any questions for myself and Shelby? Or Shelby, do you have anything you'd like to add on? I know that's a lot of information thrown at you guys.
Yeah, so just to reiterate with our diabetes prevention program, the online and in person, a year does seem like a long time when we explain that to you folks and like our patient population. But when we break it down for 1 hour a week that is dedicated to improving their overall health, that could be an easier, palatable time frame to give to people. So I just want to reiterate that it does seem like a big commitment, and it is, but when you break it down, just an hour of their time is really all it takes a week to just help them reduce their risk of diabetes and improve their overall health. And but yeah, if you folks have any questions or anything, just let us know.
Thanks for that, Shelby. So we had Anita who chatted in. What's kind of your experience with insurance coverage? Does most insurance cover it for DPP, or what are your thoughts on that?
Oops, sorry, my thing was on mute. So in regards to DPP, was this in regards to DPP? Sorry, I missed that first part.
Yes.
Oh, okay.
DPP.
Yeah, so for DPP, I know that there are insurances out there that do cover it, but definitely we would like to explore getting that connection so we can provide it to our patient populations. I think definitely there could be more expansion into getting more insurances to cover and provide, just because it's such a beneficial program. But yeah, so far, us personally, we would definitely like to make those connections and expand more to just provide this program to more of the patient population. I don't know if that answered the question.
Yeah. Well, and you do some of the legwork, right, for the patients, kind of figuring out if this is a covered benefit on their plan. Is that right? Or am I committing you to something?
We do have a billing team, so we definitely ask our billing specialists to delve into that and see if it is a covered benefit.
Awesome. And is that is Medicare Part B one of your I believe they do cover DPP, is that right?
Yes, they do.
Okay, great. We had a question from a provider from American Samoa that's only eligible for patients that have Medicare Part B. I think no, it's not limited. It depends on the different plans and policies, but definitely for patients with Medicare Part B, DPP would be a covered benefit.
I also see a question in the chat. Oh, I'm sorry, our phones are ringing. But I see if physicians need to refer, self-referral, physician referrals are not necessary for DPP. Patients can self-refer too, but if you folks have any patients in your practices that need it, then we'll take referrals as well.
That's great.
I also saw a couple of questions. Will the slides be shared? Yes, they will be shared following the presentation from Kristen. And then I think I saw, oops, let me see, there was another one. Will patients have a copay even if their insurance is accepted? We do really try to stay away from copays with these programs. We will bill the patient's insurance, and I know in the past we've normally waived any copay just because we know a lot of our patients are on a budget, and we want the patients coming to our classes and participating and not feeling the stress of having to put forth extra money in order to get the care that they need. So we really try to work with our patients. I don't know if you have anything to add to that, Shelby.
Yeah, no, that we hit the nail on the head. Yeah, so far we really just try to assist in any way we can, just because, especially with times nowadays, COVID, and with everything going on in the world, it's hard. So we just try to help as best as we can.
That's awesome. And we had someone ask another question. Any support for parents with children with diabetes?
Currently, we don't have, we don't support children with diabetic diagnosis. Like we don't have a program specifically for pediatrics, but that is something for us to look into.
Great, thank you. I'm going to put you on the spot a little bit. We didn't have an agreed upon question, but I definitely, one popped to my mind. You know, with the different approaches to lifestyle change and improving care for patients with diabetes or pre-diabetes, what do you feel about these programs that makes them successful for patients?
I'm so sorry, Kristen. It cut out for me personally. What did you say? Can you repeat that
Oh,
again?
no worries. I asked for the lifestyle change programs with DPP and DSME, what do you feel makes these programs successful for patients?
I feel that honestly, it is that group aspect. Not only do we try to make the class fun and bring things that are relatable to the table for patients when they join our program, but having that group aspect, I feel, is truly a beneficial, truly a benefit of the program because they have that support system and they are able to talk with each other and hear each other's ideas and what they experiment with and things that work for them and don't work for them. And it gives people an outlet to be able to share that and be a part of something where people are kind of like them. So I feel that that alone is a great benefit, but also the open-mindedness that all of our participants come to the table with, and they're just eager to learn, and the information that we provide is helpful, and we just try to make sure that everybody that comes to our class walks away with something that they can equip themselves to help them along the path for the future, and just making sure that we offer that support for them. So I tell all of my patients, if you have a question or anything, just call me, email me, anything like that, just making sure our doors are open for the support.
I love that. And I have no doubt that you create very meaningful attachments with the folks that you work with. And it certainly takes a village to care for our big population. Mm-hmm. So we did have a question in that vein. So if a person has a caregiver or maybe a child or something like that, are they able to attend the group visits as well?
Oh, of course. We're starting the DSME class now, and a couple of our patients are like, can my wife come? Can my daughter come? We welcome everybody, as long as we have the space, but we try to make the space for everybody. We want to make sure, everybody can bring their support system. And I tell all my patients, it's like a big family kind of thing where, bring them so they can learn as well, because it does take a village. For especially with people with diabetes, it's not only affects the person with diabetes, it affects the people around them. So I of course tell all of my patients, bring the loved one, bring a family member, whoever is their support.
That's fantastic. So when you have a person that completes the class, or maybe they don't complete the class, there's a question. If a physician or provider refers for DPP, will they get a patient report for outcomes and then any recommendations as well?
Yes, we will provide. What do you call that, follow-up? I lost my words for a second, but yes, we will provide that information to the provider, just to give them check-ins, and if the patient is still in the program or hasn't completed the program, we will provide that information as well. However, whatever way is easiest for the provider. If they want weekly updates, I'm willing to do that as well.
Great. I know when you begin the referral process with a provider, you really like to, kind of set up what the expectation is, what the referral, looks like, how you want to kind of communicate back, and you're very receptive to establishing a workflow that works for you, but as well as the providers.
Yeah, we just want to make sure everybody is in a happy and feels taken care of with our process too. Yeah.
Absolutely, a good partnership. After the event, we're going to share the referral forms as well as the slides, and then we'll get the recording out as well when that becomes available. But if we've got a provider that wants to, refer someone tomorrow, what are the steps that they would take to kick off that referral to you?
Well, they can call or email me. I think we've attached my contact information into the slide somewhere, or we'll shoot that out in the email as well. But then, yeah, just fill out the consent form for diabetes, or the pre-diabetes consent and order form, and they can fax it. Oh, I can attach our fax number as well. If they fax it to us, and then that could be a way that we can kick it off, and then I can contact and reach out just to verify everything.
Perfect. Thank you. Okay, another question. If the patient is unable to complete the classes, will they be allowed to attend again in the future? If you could answer that question for both DSME and DPP, that would be awesome.
For DSME, for sure. Except just the thing with Medicare patients, if they did our class, so with Medicare patients, their benefit is 10 hours of total diabetes education in their first year that they initiate that diabetes education benefit. So what that entails is 1 hour of one-on-one education and 9 hours of group education. So once they initiate that benefit, if they don't complete the class, they'll lose it. And then the following years after that, it'll be 2 hours of education for the year. So with Medicare, it's a little bit tight with attending the group classes if they want to do it again. But for all other plans so far, to my knowledge, I don't think there is a limit. So they can come to classes again if they want to, and if they need to. For DPP, for sure, yeah, if they want to come back, they can come back.
Awesome. We know sometimes we need a little bit of time and flexibility, so that that we've got that. And Medicare is a little bit more rigid, but
but yeah, if somebody used up their Medicare benefit, just reach out to us, and then we'll see with our billing team what's possible.
Great. Always good to have those subject matter expert billers in our corner.
Yes.
Great. Any other questions from the audience? All right. Well, it looks like we've got all of those questions answered. I want to thank you both so much for your time and expertise. We do have the contact information on the screen here, so most definitely take a peek at that. We'll send out all of the referral information as well as the slides after the event. I want to thank you all for your time and joining us today. We hope you got some good information and maybe sparked some ideas of which patients could benefit from these referrals. All right, great. Well, Shelby, Cleanne, thank you both so much. Is there anything you'd like to say before we close out?
I just wanted to thank you for getting this together and helping promote us, Kristen. And I wanted to thank everybody for joining us. We hope to hear from you soon with some any of your patients that you think might benefit from our programs.
Yeah, I would like to just add nothing to add on to that other than thank you all for listening and taking the time. And if you have any questions, just reach out to us.
Great. Thanks so much, everyone. Have a great day, and we will talk with you soon. Take care. Be safe out there.